Hello, Professor Dr. Walker. My name is Zakir. I'm going to present today. 8 years old Caucasian female come to the clinic with the chief complaint of left eye redness and pain. The patient has been in good health before coming to the clinic. It has been 2 days. The pain is aggravated by lights and no living factors when she sleep rather than when she sleep, and the area was like the corneas was whites of the eye. It has no specific timing of the day, and the itching that the patient is experiencing is with the redness she is experiencing in her eye. Left eye discomfort, and has been more than 2 days. It was it started suddenly, and she didn't take any medication rather than the over-the-counter naproxen, and no relieving after that. That's why they decided to come to the clinic. The pain is like 4 out of 10. The discharge coming from the patient's eye is described having a greenish tint. The beginning of the symptoms was abrupt. About like 2 days ago, there was no blood in the discharge, and it had no exacerbating relieving factors rather than the light. Past medical history is she doesn't have any medical history, and the only medication she's taking is for pain medication, PRN. She never had such kind of sickness, illness, and she has never been had any surgery, never been admitted in hospital. She is family history is she the second child in house, and nobody got sick with the same problem. Mother, father healthy, working, and family history of hypertension, only 65. Maternal grandmother, all are alive. Social history, the family, three patients, she the second, as I said. The parents are both still living. Immunization, she she's up to date all immunization, including seasonal flu shot, pneumococcal vaccine, tetanus shot, and she didn't take a COVID vaccine. The patient had no history of chills, fevers, headaches, vomiting, excessive sweatness throughout the night. The patient claims they do not have any discharge, stiffness in their nose, or swollen tonsils. And the patient, she has not had any symptoms like no breathing issue or chest discomfort. Musculoskeletal system is within normal limit. CNS, she's enough to for no headache, memory loss, or seizure. The vital sign is blood pressure 107/74, heart rate is 76, respiratory 18, oxygen 98, temperature 98.2. She's not fever, pain. Right now she said 3 to 4, but right now she said 3. Physical exam, patient was appropriately dressed, or alerted to time, place, and the circumstances. And it seems like she's excellent health and getting healthy rather than uh, this chief complaint. When we come to the eye exam, in the right eye, there was a white sclera. There was no signs of redness, discomfort, discharge from the conjunctiva of the cornea. It was possible to see the lacrimal ductus. And the left eye is redness on the sclera of the eye was apparent, was a greenish discharge from the eye. Ears, Weber, and Rennie test is negative with the normal. Nose, septum is a flat. The throat is buccal mucosa is everything is soft and moist with the normal limit. Okay, the differential diagnosis is gonna be my first differential diagnosis keratitis, because the redness and the pain of the patient experienced in the left eye is important indication of the patient this direction. And the second differential diagnosis is going to be conjunctivitis. The redness of the eye that patient is experiencing on the left eye is important indication. Conjunctivitis may be caused by wide variety of factors such as bacteria and fungi, virus. And the third is blepharitis, which is the redness of the pain and patient experiencing the left eye causing. But blepharitis is a condition caused by localized inflammation. To classify blepharitis, one must look like location of the disease and manifest anteriorly affect the skin and eyelash, while others, which is manifest priority. So in this case, mostly it looks like considering the patient major symptoms of redness and discomfort, patient left eyes, there is makes sense the patient redness and greenish discharge is what makes keratitis. During physical exam, diagnostic test that we ordered is hemoglobin, ESR. If it's infection, like WBC is gonna be leukocytosis, and ESR is after an hour the number of the blood from the anticoagulant whole blood is gonna be high. It's was 26. The plan or treatment is there are different variety of treatments and different side effects. Could be the ciprofloxacin 0.3 ophthalmic solution, and I know the age is 8, but I don't think it's most. That's a doctor. He says okay about that, and another tabromycin with vancomycin or cefazolin or moxifloxacin. All those are the different varieties of treatment. Patient education is counsel a patient, help understand the condition, and we have to teach the patient about the complication of if they don't treat it well, they're not taking the antibiotics on time, and it can cause, like keratitis can cause a vision loss, ocular perforation, and endophthalmic problem, and a corneal ulceration too. So the patient mother should have been warned a potential complication of the medication prescribed, and we have to teach about the medication. Eye pain, acute irritation, redness, skin rash, hives, those are side effects. Make sure the patient understand and properly care of the eyes, and we have to make the follow-up for the coming for after 2 weeks. If not, we have to refer to the specialist. Thank you so much, Professor Dr. Walker.